I first got interested in nursing when I had a baby. Never thought about it before that. And then I heard the nurses out at the desk and in the nurses station talking, and they were laughing and whispering because it had to be quiet in the hospital. And I just liked the atmosphere. And I thought, these people like what they're doing. I think I could do this. And so when my kids got a little bit older and were able to get themselves on the bus, I went back to school. When I was in the hospital, when students would come up, I'd get all excited. And I had good relationship with the other instructors, but there came a time when one of the instructors was having surgery and asked me if I would do a clinical for her. And she had been encouraging me, said, you would be a good instructor. And I'm like, well, we need good people with that attitude on the floor too when students come up. So I had no desire, had no thought in my mind to switch over. And then she let me do her clinical, and I'm like, this is wonderful. To really interact more long-term with the students, not just for a few moments when I'm showing them how to do an injection or something, that I liked discussing it with them afterwards. And then when I got my bachelor's, I realized this is an option for me. And that's when I made the transition. A few months after I got my bachelor's degree, I said, I'm just going to go over to Jobson and see if they'll let me work there. I can relate to those students who are coming in later in life and maybe doing a transition of switching to something that they really want to do. I had a lot of encouragement from my instructors, so I know how important that is for students to get that, because nursing school is hard and it takes time and effort. But if they've got the grit to come in and sign up, I think they've got what it takes to finish too. I think there's a big similarity when you are serving others to help them to be in their best place in life, which I did as a nurse. I wanted the best for my patients, and that's what I want for my students too. I think about what they're going through and how this is like, they're kind of like in our turf. Like as a nurse, when they came to the hospital, the patients were out of their comfort zone. Sometimes the students feel like, is this the right place for me? And so you have to build a relationship with them, let them know that you're on their side, just like I did with my patients. Like I'm an advocate for my patients, I'm an advocate for my students. So it really is a lot of crossover in the two careers that I've had. When I get, where I get a lot of joy is when there's interaction in the classroom. When I see them asking questions about what I just said, and that they're really interested and curious about the content, I feel like they know that this is important and they're interested in this. And I have found that even when I worked in the hospital, no matter who was, what job they had there, I respected them for wanting to work around where we were taking care of people. And I respect my students for that same thing. This is what they want to do. And so when they are asking questions, I see them preparing themselves to take care of people, and I really respect that in them. For Nurses Week, it is so exciting that it's when nurses are celebrated and that we can all celebrate each other. And people notice this, and I get cards from like my children and everything. It's kind of like another Mother's Day. But it's a time for us to celebrate what we do and the difference that we make in the community.